So we were able to gather a group of resident family practice physicians who were very enthusiastic about joining us, and several physicians from Shasta Community Health Center, as well as my own private practice at Sayla Women's Health. And we put together a group of 8 physicians and their spouses, and off we went to Bangladesh together.
So each year we take a international trip with support of the health center to provide education to midwives and providers who deliver babies. And across the world, there's a high incidence of neonatal death after delivery from just not breathing right. So we can intervene with this in a very simple way and give people tools that can really make a difference.
So really where this vision was born to do this project developed from some data that we were collecting by our nonprofit. We were working with an in-country partner who was providing some basic prenatal care and education in the villages through nurses. And they were keeping some data that was showing that they were experiencing a really high mortality rate for babies. We were really shocked by it. It was something like 15 to 20% of the babies that were born in these villages were listed as deceased after birth. And when we dug into that a little bit, it sounded like they were actually dying in the first couple hours after birth. And it began to stir in us, realizing this is a target. This is a huge need. We need to help these nurses provide something more to these babies so they can live, because that's not acceptable. And as we began to think about that, we encountered this program, Helping Babies Breathe, and realized this would be perfect. The program is really robust, which is fantastic in that it's developed, it's got flip charts and it has written materials, and it also has equipment that's all based around the idea of a small group learning together on a mannequin, and really basic, carefully laid out instruction that's not rushed. And we really love the curriculum. The curriculum is great for teaching learners of various skill levels and knowledge. So, and in particular, it's very versatile to translate. So we were able to actually get it all translated into Bengali. We went to some villages where we met many of these women who are receiving the care from the nurses and the midwives that we were training. And that was really exciting to see their enthusiasm, to see their gratitude, and to really get a sense of the living conditions and the needs. Like it was astounding to see how happy and joyful they were with very little.
Actually, in Bangladesh, there is so many village midwives. Many years ago, traditionally, they are working on the delivery works. So, uh, so many delivery they had happened. They did it, but after I see the Helping Babies Breathe, the course conference, I found, yes, there is so many village midwives they can deliver, but they didn't have any idea about how to help a newborn baby. And that's why so many newborn baby were died in past. So I used to say this is the right things to teach the village peoples, village midwives, and even our nurses and doctors. Then they may learn how to help a newborn baby's breathe, because a new baby means a new life. So this is actually at the course of Save New Lives. So it was a big challenge to organize the doctor translators.
It's outstanding. I am very much pleased with the teachers and the participants also. The participants are very much keen to learn from the American doctors, and they are very much happy by the new techniques, and they have tested, and they are also tested about the things what they are teach in the first day. So I'm very much happy, and and I also learned so much things from the doctors as well as the participants. Obviously, I am going to teach you the materials to the not only in my hospital, but also I will try to go to the village and in the field, and try to make the best use of the materials by using them in the babies and the pregnant women in the rural areas who cannot go to the hospital, and the midwives and the nurses who plays an extraordinary role in the rural area. I will teach them also.
The medical equipments we are using, all the medical equipments are providing by Shella Health International, and we have a lot of project plannings to improving our projects over Bangladesh, and we have confident that together we can do so many things. We can make a change for the nation. As I learned from here many things, so I want our village people should be know this kind of things, and I wish the all people can learn about the helping babies breathe, and they can help.
Oh, okay. She did deliver before a lot of babies, but now she's telling this since she is introduced with the equipments that will be more helpful.
The interpreters are amazing. I think that's something that I didn't consider when we were coming over, is how difficult it would be to try to communicate with these ladies. They are so smart. They have been providing care to their community for many years, but we're trying to teach them a very American way of doing things, and by teaching them through English. We have a couple of wonderful doctors that are translators as well working with us.
It's cool. It's cool to see like how much they know and like how they're trained. It's more of like a partnership than like, you know, you're just a translator sitting here, like they're learning too, and then I'm learning like stuff that they know, and it's like a really cool thing to be able to share that experience.
Okay, I feel happy and I feel lucky to have there, and it was a nice experience for me. And in the first class, our trainee was nervous, but in the second class, they are confident and they are very smart, and they already they knows everything.
It's kind of eye-opening in a lot of ways, and it's cool to see that there's so many kind of commonalities between the way we approach medicine and the way they approach medicine. From here, I would love to continue to do this. I would love to do this more. I think wherever I end up, however I end up practicing medicine, I will be doing something international.
The all trainees were very happy, and they gave their opinion to me, and they said their opinion like that. We did lot of delivery before, but we had not this kind of experience. And also we saw some babies who had died. And if I could have this course before, maybe I could save the babies.
Certainly, leadership for Gospel Movement Foundation put a lot of effort and work into recruiting all the nurses and midwives. There's always a lot more work behind the scenes that take hours and hours of diligence. So really grateful. We couldn't have had the impact that we did with all of that. Putting together a project like this obviously takes a lot of funding and resources, and we are just so blessed that we had a lot of resources available to us through both Shasta Community Health Center's generous contributions, as well as Sail Health International's donors. And certainly that was huge in funding all of us to go, all the equipment that we took, the equipment that we left with the nurses and midwives. We brought 7 physician trainers with us, and we actually were able to train a total of 96